think that dry eye is underdiagnosed and undertreated in our society.
Do your eyes sting, burn, or itch? Have you stopped wearing contact lenses due to discomfort? Up to 21% of Canadians suffer from dry eye disease, a condition that occurs when tears aren't able to provide adequate lubrication for the eyes.
Dry eye is a condition that occurs when the tears that we're making are not good enough to keep our ocular surface lubricated, healthy, and happy. The most troublesome symptoms are the ones that prevent patients from getting through their everyday activities. Screen time is a big one for mild and moderate dry eye patients, but as dry eye worsens, the effect on your quality of life can be dramatic. Some studies have shown that moderate to severe dry eye is akin to suffering from severe angina or having to undergo dialysis. That's how much it can affect people's livelihood and lifestyle.
For me, it's difficult to read for a long time. Working with screens or reading on screens like tablets and computers. Put on makeups, I don't barely do that because it gets my eyes dry. Sometimes I have difficulty, night vision when I drive.
So there's this cycle of inflammatory reactions that can occur once dry eye starts. For those who do have symptoms, the symptomatology is very variable. Certain people just feel a gritty sensation. Some people get burning, tearing. Contact lens intolerance is a big one. Difficulty staying at their screens for too long is another important one. Itchiness, redness of the eyes.
Like sometimes as if I had sand, a little bit of kind of itchy, gritty in my eyes. My eyes were red also sometimes. I have now I have sometimes blurry vision at night. I cannot stare for a long time. I need to blink, so I blink a lot.
Don't let dry eyes go untreated. Taking care of dry eyes not only relieves discomfort, but can help you avoid infection or even scarred corneas.
The earlier you treat it, the easier it is to treat, and the less likely you are to end up in this vicious cycle of inflammation. Once dry eye is advanced, it can actually have long-term effects on your ocular health. So early dry eye, sometimes the exam is completely normal, but the patient has symptoms. But advanced dry eye, your ocular anatomy changes.
I tried the artificial tears, the over-the-counter ones at first. It helped, but not that much. And then I went to the specialist clinic, and they helped me a lot. They did all kind of tests.
It's important to treat dry eye early because the earlier you get it, you have less inflammation and it's easier to treat. Some patients have such mild dry eye that really all they need is breaks from their screens and some over-the-counter artificial tears, and that's it. But if you are suffering from true dry eye in that those things are not helping and the symptoms are ongoing, then the earlier you see an eye care professional and get treated, the more likely it is that it will not control your day, it will not affect your lifestyle, and that you will not have to think about your eyes on a day-to-day basis.
I like to read. I do love reading, so I like to walk in trails in the woods. I like to learn, studying another language or stuff like that. This is the things I love. If you have symptoms of readiness, or if it's itchy or anything, go see your doctor because they can help you.
I think it's important for all Canadians to know that dry eye is extremely common. If you have symptoms of grittiness, burning, tearing, fluctuating vision, contact lens intolerance, difficulty at your screens, go see somebody. We can help you. There are a lot of treatments out there, and any eye care provider can have a quick look, ask you questions, and make sure you're on the right track for ocular health.
Please speak with your eye care professional with any concerns regarding symptoms of dry eye disease.